Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Dr. Freddy Gomez, sitting in for Pinky Webb. Today on the program, COVID-19 cases are again on the rise with alarming projections from experts. They are also concerned that recent case spikes are no longer just a holiday uptick. The Health Department stands by its decision to stop issuing its daily case bulletin on social media amid reactions from lawmakers and groups. It also clarifies that daily COVID-19 case numbers will continue to be provided to the public. And amid the Omicron variant threat, should parts of the country remain under alert level 2? Presidential Advisor for Entrepreneurship Joey Concepcion and former National Task Force Special Advisor Dr. Tony Leachon joins us live. The Octa Research Group projects around 1,200 new COVID-19 infections nationwide today, and at least 400 in Metro Manila. This comes after the National Capital Region's daily positivity rate rose to more than 5% for the first time since October. Octa Research fellow Guido David says there is now a concern that this is not just a holiday uptick. With the growing concerns about the Omicron variant, both the Health Department and the private sector want the country to remain under alert level 2 in January. Let's go straight to the source of the story, Presidential Advisor for Entrepreneurship, Mr. Joey Concepcion. Mr. Concepcion, thank you for making the time and welcome to the source.
Good morning, Freddy.
Now, the Health Department has so far detected at least four Omicron variant COVID-19 cases. Now, the DOH adds it's only a matter of time before magkaroon ng community transmission. How concerning is this, especially for the business groups?
Well, of course, it's a concern, but let's not panic because as we see what's happening in South Africa and in Indonesia, Father Nick was explaining to us that the cases seem to be mild. And while it's highly transmissible, what's important is that our vaccines still do prevent severe illness and hospitalization. No? So, yes, we had higher mobility in the last quarter. I mean, after really the private sector calling that early lockdown on August 8th, we achieved the objective. No? I think let's put it in the proper perspective. No? Mm-hmm. Did the country do well? Yes, we planned for this, and that's why our fourth quarter was quite robust because we had the lowest cases out there. And of course, in the fourth quarter, you have the highest mobility. People go out, people meet friends and family. It's been a long time. And there is an uptick, of course. But remember, we're approaching now the first quarter of the year. And that's going to be the slowest quarter of the year. So there will be lesser mobility because wala nang pera mga tao, ginastos na nila. No? So there will be less shopping and all of that. No? So I expect that cases will be muted or at least stabilized, hopefully, if Omicron does not hit the land yet.
Okay, I think with regard to the Omicron variant, maraming unknowns talaga, Mr. Concepcion, no? So what are some of the biggest unknowns regarding the Omicron variant that could influence whether the Philippine economy may falter in the coming weeks?
Well, let's put it this way. What is the objective? To fully vaccinate our people, no? And we've achieved that in NCR and some areas of Luzon, and we're really ramping up in the rest of the country, no? So vaccination, whether with the regular doses or with the booster shots, which has been approved right now for 3 months, no? You can now, from your second dose, take your booster shots after 3 months. So we have all of that. We have so much vaccines. AstraZeneca has fully delivered their vaccines yesterday to the private sector and the LGUs. No? Moderna will be the same. So we have the ammunition to really deploy to our citizens. There is no lack of vaccines for both regular doses and booster shots. Now it's the implementation and we're ramping up. So what is the advantage of the Philippines over the other countries? Our cases are still low. Today, I think it was like 300 or 400. So it fluctuates. No? Is it on an uptick? Yes, because of the celebration in the fourth quarter. Is there a possibility that Omicron will come to this country? Of course, it is going to eventually penetrate the Philippines. But what is very clear, that's seen all over the world, that Omicron seems to be milder than Delta, but much more infectious. Now, we should look at infection levels. If infection levels go up, are these people fully vaccinated or not? If they're fully vaccinated, we expect that they will be getting well at home and not in the hospital. So we should monitor the hospitals. Is there an uptick in the hospital capacity right now? And that should be our benchmark. Let's not panic when infections go up, because the number of people that have been vaccinated is quite high, especially in NCR.
Okay, that's very good to know. But as a lot of people know, one of the most devastating things that occurred, especially with the Delta variant, ay yung mga nationwide lockdowns, especially its effect on small to medium enterprises. With that being said, in case that things don't go as planned with this Omicron variant, will you support another nationwide lockdown should cases surge again, like what is happening in other countries like the US and even China?
We supported the early call for the lockdown ourselves August 8th last year. I mean, if it comes to that, that will be our last resort. But at this point in time, I don't see that happening. We are focused on granular lockdowns at this point. The cases are still low. Let us determine first, even if we hit 1,000 infection levels on a daily basis, let's find out, are these people running to the hospitals? Because if they're just getting well at home, this can eventually turn like just the flu. So you will have more cases, but they will be mild. So we have to see if the Philippine condition will be similar to South Africa and Indonesia. And if that is the case, then let's not panic. People will stay home and get well. Now, if it will be different and these people will be going to the hospitals, which means that our vaccines are not working, then that's when we worry. But I'm more optimistic that these vaccines that we have, and that's why the boosters are being deployed as we speak now. We're not waiting for 6 months before you take your boosters. You can take your boosters 3 months from your last dose. No? So that is going to provide us more fortification in our immunity defense. No?
Okay, and with that being said, Mr. Concepcion, what do you think should the government prioritize in addressing this Omicron threat that is definitely just around the corner?
Well, as you know, we have to vax to the max, open it to all sectors, and give those who are in the priority sector a fast lane. But let's open it to everybody. Vaccinate the 12 to 17, give boosters to all of those who are already waning with their vaccines, and those in the far-flung areas and the rest of Visayas and Mindanao who are still unvaccinated. The citizens there have to want to get vaccinated. Do your share, get vaccinated, and we will have a better. We had a great Christmas. You want to have a better 2022 new year? Then we have to do something. We have to get vaccinated or get boosted. Either one of the two.
Yes, that's true. I agree with that, definitely. But will you push for the downgrading towards alert level 1? Currently, we are at alert level 2. Will you push for alert level 1, given, that slight uptick of cases right now? Or do you think that the status quo, being at alert level 2, is still safe for now?
I've shared this with many that we should stay at alert level 2. There is no need to move to alert level 1. The businesses have definitely recovered in the last quarter. Everybody was extremely happy. The bounce back was about 80% of pre-pandemic sales. So that's great. And what is more important is we sustain this. We have to keep the economy open. Both the micro, small, and medium enterprises cannot afford lockdowns because we need revenue to be able to pay loans and suppliers. And likewise with the national government. How do you expect the national government to pay for our debt? We're borrowing money heavily, trillions, to be able to fund all of these health initiatives. Without tax revenues coming in from them, the government will go bankrupt. I mean, we can't afford it. We have to continue to grow as a country. We have infrastructure, being built right now. So the country cannot afford a lockdown. And again, our friends in Octa who has advised us greatly on locking down on August 8th, we have met with them. We should just keep in mind, let's not panic. The numbers may go up. It is going to go up because of greater mobility. In the first quarter, there will be lesser mobility. So let's just pray that Omicron will not devastate this country. But the one thing we have is that we are at very low levels at this point in time. Yes, it can go up, but let's determine, are these cases that are going up serious cases or mild cases? If they're mild cases, let it be. Let them get well at home.
Okay, now let's talk about vaccinations for a second. Let's shift to that since a lot of our discussion right now involves or revolves around being vaccinated. As of December 25, Mr. Concepcion, 7 million Filipinos pa ang dapat maging fully vaccinated by the end of the month to meet the target of 54 million and achieve population protection this year. What do you think are the challenges that you see right now?
Well, there is still vaccine hesitancy, but I'm glad that the IATF has approved that on-site workers, our workers, and other employees out there who are not vaccinated will have to take an RT-PCR test every 2 weeks. And that will cost them 70,000. We are not paying for that. The employee will have to pay for that. And that will be implemented this year. We avoided implementing it during the Christmas period, but now for those employees who are not, we will implement it. Why? Because we need to do it. Everybody in this country has to get vaccinated. This is a national concern right now. We are in a pandemic. If we want to move the pandemic to endemic, everybody has to be vaccinated. Everybody who needs a booster has to get boosted. Our 12 to 17-year-old children have to get vaccinated. And eventually the 5 to 11 kids who want to go to school face-to-face also have to get vaccinated.
Okay, and with those facts, Mr. Concepcion, do you think that we should expedite yung rolling out ng booster shots against new variants, especially with this Omicron?
Well, I'm extremely happy with DOH, FDA, and of course the vaccine expert panel. They really approved the short-term duration to 3 months. No, in record time. Even in the States, it's still 6 months. But here in the Philippines, we've already been aggressive. We brought it down to 3 months. So we are, and that was just announced about 2 weeks ago. So the private sector is now going to implement it. In fact, our own company, starting January 2, we will implement the booster shots 3 months from their second dose.
Okay, thank you very much, Presidential Advisor for Entrepreneurship, Mr. Joey Concepcion. We'll be taking a break. More on the country's COVID-19 situations when we return. We speak to former National Task Force Advisor, Dr. Tony Leachon. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Dr. Freddy Gomez. Our guest today, former National Task Force Advisor and Health Reform Advocate, Dr. Tony Leachon. Dr. Tony, thank you again for making the time and welcome to The Source.
You're welcome, Freddy, and good morning, everyone.
Dr. Tony, at least four Omicron variant cases have been confirmed and detected here in our country. The DOH says it's no longer a matter of if, but when, bago tayo magkaroon ng community transmission. What should we closely monitor?
Well, we need to monitor, of course, the incoming passengers, particularly those in countries with surges. Of course, Europe, particularly United Kingdom, and then you have right now with 100,000 cases, also France, and then United States of America, around 180 to 200,000. So these are countries which are actually richer than the Philippines and with enormous supply of vaccines. So we need really to monitor these particular travelers to our country. And of course, upon of course assuming that they're positive, then we need to fast track the genome sequencing so that we'll be identifying these particular patients, or else there might be local transmission just in case they will actually be able to be sent home without testings. And this is right now the main contention in the CDC, in which they shorten the isolation from 10 days to 5 days without the benefit of a negative test. So these are important things that we need to consider.
Okay, so Dr. Tony, what you're mentioning is yung borders natin ang dapat ma-monitor dito. That being said, some countries are actually having a 21-day quarantine period for people coming from other countries, including here in the Philippines. Do you think lengthening that quarantine stay of travelers from other countries here in the Philippines will be of help on trying to control the spread or a possible surge? Alam ko, hassle yun para sa mga parating dito, but medically, will that be of help?
I think we have to stick with the 14-day quarantine based on the incubation period. I think the spirit and the rationale for the 21-day, and that is based on the Hong Kong model and also the Singaporean model, is that they really want to control transmission. And since the incubation period will be variable from one patient to another, it can be from 1 to 21 days. So without the benefit of a test, they can actually discharge the patient after 21 days quarantine. And that is, of course, to protect their economy. And of course, they have deeper pockets because Singapore and Hong Kong are the two most actually progressive countries in Southeast Asia.
Okay. Dr. Tony, so far, Delta variant pa rin ang predominant dito sa Pilipinas. Do you think eventually Omicron na ang magiging prevalent, just like how it is in the United States? Papunta ba tayo doon?
Yes, I think, pupunta tayo doon, Freddy. And right now, it's about 75% in the US. And sa atin naman, 90% ang pa rin, or 95% pa rin ng Delta. And usually, historically, dumadating yung variant sa atin 2 months after the occurrence based on the country of origin. So, let's say it was first announced sa South Africa, nalaman natin on the 3rd week of November. So, we might actually feeling the impact of the Omicron variant sometime in the 3rd week of January. And that is historically based on the 3 surges that we had before. And the last one with the Delta variant, it happened in India sometime in April. Then it arrived in the Philippines June or July with a peak in September.
Okay, Doctor.
So we need to understand this.
That's right. Dr. Tony, let's go for a second to what the Octa research recently said, because they said that the positivity rate in Metro Manila last Tuesday exceeded the 5% threshold. Explain natin sa mga viewers, what does this indicate, especially when it comes to the business sector?
Ang ibig sabihin ng positivity rate is the number of positive tests over the number of total tests. And it is based on the WHO benchmark that those countries with more than 5% would mean increased viral transmission. It was first observed by a professor from Stanford, Thomas Peyo, and then observed in many countries. That's why the benchmark used by WHO is actually less than 5%. So we're reaching right now 5%, that is for the NCR. And that's an ominous sign considering that the Omicron transmission is not yet here. And we might actually be feeling right now an increase in the mobility this holiday season, and sometimes it rolls over January. Remember that we have one important event in January, and that is the Black Nazarene, in which a lot of people will be coming in the National Capital Region. Now, and the NCR is 5% at this point in time.
Dr. Tony, what should the government do then to address itong Omicron threat head-on?
Well, the best way is actually to increase the testing. As you can see, based on the report yesterday, we had only 18,000 testing. But what Israel, for a small country, they're doing 100,000 tests. The population of Israel is 10 million. But NCR, we should liken, itulad na lang natin dapat ang NCR natin sa Israel kasi magkasinlaki naman sila. So let's say NCR is about 12 million. So we must be doing 100,000 tests per day. Kasi kahit sinasabi, let's say, ng mga experts na ang Omicron less ferocious and less virulent, pero more transmissible to than Delta. So hindi ka nga ma-hospital at pwede kang home management. once positive ka naman, hindi ka naman makakapasok. So therefore, pag nag-positive ka, it will also hurt the economy. Unlike the Delta, is more ferocious. And therefore, kung more ferocious siya, remember 400,000 cases and 4,000 deaths before. Right. So it affects us, na-overwhelm yung ating hospitals, yun ang nagproblema. Pero the Omicron will still hurt the economy kasi hindi ka papapasukin sa workplace. So dapat, ang ginagawa natin ngayon, aside from the massive testings na 100,000 per day, tracings, dapat mag-boosters tayo. Kasi dun sa findings, kailangan ang panlaban natin for the Omicron is the booster.
Okay.
So assuming that the
yun.
vaccination rate in the National Capital Region is of course 100%. So we need to fast track the boosters right now.
Yes, pag-usapan natin yun, Dr. Tony, because napaka-importante yun, especially when it comes to boosters. CDC or WHO recommends 6 months. Here in the Philippines, 3 months. Pwede na. But ang tanong ng marami is, ganito na ba magiging ang patakaran? So, will we see regular doses of boosters? Should we consider administering a 4th dose of COVID-19 vaccine to fight all of these variants, including Omicron?
Well, ginagawa na sa Israel niyan. Ang una kasi naglagay ng booster ay Israel in July. Nung they celebrated when they ditched the mask because of their successful vaccination, nagkaroon sila ng surge sometime in July. So they started with the booster. And that triggered also the US FDA to copy yung ginagawa ng Israel. Sa Israel ngayon, they're not contented. So above 60 and those patients na immunocompromised, they would start with the 4th dose. So lagi silang ahead, no? But sa atin ngayon, since 100% sa NCR, that's important na magkaroon tayo ng boosters. Pero ang boosters natin, remember, ang iba pa nga sa rest of Luzon, 50% pa lang. Ang contiguous areas mo like Calabarzon and Central Luzon, mga 50% pa lang siya. And then we have also problems sa Visayas and Mindanao. And besides Mindanao, ang vaccination rate natin 30%. But with the relief operations niyan, sometimes kung nagkaroon ka ng surge in the countryside at mababa ang vaccination rate at mataas ang vaccine hesitancy, baka magkaroon tayo ng migration of the surge coming from Visayas and Mindanao to the National Capital Region. So kailangan bantayan natin yan. Kasi maaring wala tayong Omicron pero may Delta variant pa rin tayo.
Yes,
so it might actually
true.
cause some problems. Ang tawag dyan is reverse migration. So kailangan nating isipin ito because if you remember, doon sa Delta, kumalat yan sa buong Pilipinas.
Okay, Dr. Tony, thank you very much for that. But we'll be taking a short break. This is The Source on CNN Philippines, so please stay tuned. You're watching The Source on CNN Philippines. I'm Dr. Freddy Gomez, sitting in for Pinky Webb. Our guest today, former National Task Force Advisor and Health Reform Advocate, Dr. Tony Leachon. Marami talagang questions tayo, especially with the uncertainty of the Omicron variant. But I'll go into this latest news on the Department of Health bulletin, for that matter. Dr. Tony, you opposed the decision of the DOH to stop the release of daily COVID-19 case bulletins on social media. Hindi naman daw tinatanggal ito, Dr. Tony. Ine-explain na lang daw. Iniiba yung format. Could you explain to us why this is not agreeable to you?
Because we have a national dashboard. And during the time that we have a potential threat right now of Omicron, and we have right now increased number of cases, increase in the positivity rate, increase in the active cases. So all the more that we need to monitor. And if you're going to tell the people na pumunta na lang tayo sa DOH tracker natin, then that is subject to the interpretation of a lot of people. Now, kung gusto na natin na mag-focus on certain items, then we need to add another infographic. Kasi based on the Bloomberg Resilience Ranking, ngayon pa lang tayo naging number 50 from number 53. Ang napaka-importante dyan is the diagnostic dashboard. Anong ibig sabihin ng diagnostic dashboard? Ang diagnostic dashboard is based on the number of cases, the positivity rate. So kung hindi natin siya ilalagay, paano natin ma-alert ang mga tao, particularly the workforce, kung mataas ang cases nila? Paano makakapag-ingat? Paano mga estudyante? So wala tayo, pati mga LGUs, hindi nila alam yan. Ngayon, paano kung mahina internet mo? You don't have connections.
Okay.
How can you be able to address that?
That's
And
right.
that will be a different scenario. So parang may kotse ka, wala kang dashboard.
Okay.
Or you're in the hospital as a doctor, and then you ask the nurse for vital signs, and sabihin niya, Doctor, tingnan mo na lang sa computer.
Okay. Dr.
That is unacceptable.
Yes, Dr. Tony, really quick, because lack of time, really quick regarding the PhilHealth situation. There's a proposed PhilHealth holiday from January 1 to 5. What's your take on this? How do you feel about this?
But it's sad because there were about 2 or 3 congressional hearings already for PhilHealth. And in the last 5 years under the Duterte administration, you have 5 changes in the leadership of PhilHealth. From Dr. Dineros, Dr. De La Serna, Dr. Roy Ferrer, and then General Morales, and then you have Attorney Dante Gueran. And you have an oversight committee in which you're going to report the PhilHealth findings. And still you have a problem right now. So they have addressed the corruption, but right now they have not addressed right now the unpaid claims, and that will be a problem.
Dr. Tony,
so what I'm trying...
Yes, Dr. Tony, but with regards to this, they proposed a debt credit payment scenario where 60% of yung utang ng PhilHealth babayaran upfront and then the 40% later on pag ayos na yung mga papers or accreditations or whatnot. Is this enough? Do you think this is enough to stem the paghiwalay ng mga private hospitals with PhilHealth?
I think ang decision nila, ang PHAPI, i-stall muna nila yung decision na yan kasi we will be hurting the people.
Okay.
What they should do is to sit down on a table of brotherhood and talk with the medical associations and then the PHAPI, and then of course the other agencies. But I think long run, in the long haul, Freddy, right man for the right job. The next PhilHealth CEO or president under the new administration should be a man with financial management expertise, with a skill set on audit and risk management and actuarial science. And perhaps it should not be reporting to the Department of Health, but to the Department of Finance.
Okay.
So because it is a financial institution and we can manage, of course, the balance and of course the expenses and other problems related to finance and audit.
Very true. Thank you very much, Dr. Tony Leachon. And thank you for joining us here on The Source. I'm Dr. Freddy Gomez sitting in for Pinky Webb. You're watching CNN Philippines.